provides the rhythm for the other cranial bones. Both the falx and the tentorium attach to the sphenoid. The sphenoid nosedives during flexion, then pauses and reverses this motion in extension, creating a lazy 8 pattern. In the opposite motion model, each wing of the sphenoid alternately moves into flexion. The sphenoid and the occiput are joined at the sphenobasilar junction. It is because of this sacrum-occiput-sphenoid connection that clients will frequently feel their sinuses clear or experience some other sensation in their head while you are working on their sacrum. The pituitary gland rests next to the sphenoid. If the sphenoid is compromised in its motion, it can affect the pituitary and the entire endocrine system. Check the sphenoid for restriction when clients have headaches, sinusitis, back pain, learning disabilities, temporal mandibular joint dysfunction, or vision problems. Our first technique is the sphenoid release. Sit at the head of the table and lightly rest your fingers on the occiput. Place your thumbs over the wings of the sphenoid bone. As the sphenoid is halfway between flexion and extension, very gently encourage the greater wings to move posterior or towards the table. This motion compresses the sphenoid towards the occiput. Hold the sphenoid in compression for a few seconds until you feel it start to gather energy or ask to be decompressed. Now with your thumb pads, gently guide and encourage the greater wings in an anterior direction or towards the ceiling. As you feel the sphenoid float upwards, you will notice a freer and larger cranial rhythm. This is the basic technique. The next step is to evaluate for specific motion in the sphenoid bone by encouraging motion in the following directions: flexion, extension, side bending, torsion, translation superior and then inferiorly. If there is an obvious sense of ease in one direction and bind in the other, then you have discovered a lesion. To correct this, guide the bone into the direction of ease and then follow the inherent motion. Coronal shear. After performing the basic sphenoid technique, you may want to listen more deeply to the bone, especially if you have noticed a movement pattern that seems irregular. If the sphenoid seems to be stuck or severely compressed, use the coronal shear technique. It is one of the most effective techniques to sense the movement in the sphenobasilar joint. This grip frees the coronal suture and facilitates motility in the sphenoid and occiput. It is used most often to treat and monitor severe trauma which result in a compression lesion. A compression lesion is felt as no movement. This lesion is the most dysfunctional that can be felt. If your client has been in an accident or has had a blow to the head, she may have a compression lesion or vertical and lateral strain. You will need a finger cot for your little finger or a glove. Place these on your right hand. Cradle your client's occiput in your left hand. Hold for a few minutes to begin feeling the cranial rhythm in your hand. Allow your client to settle into this hold before you engage your right hand. Have your client moisten her lips and open her mouth. Slowly and gently slide your little finger along the outer surface of her upper teeth on the left side of her face. Place your middle finger on the greater wing of her left sphenoid, your thumb on the right wing of sphenoid, and allow the hand wedge between your thumb and index finger to rest near her third eye. The grip is light and gentle. This technique can be done sitting or standing. Just make sure you are comfortable and are not straining your neck, shoulders, and arms. Feel for motility and listen deeply for movement. Are you feeling and sensing a flexion or extension? Is there a torsion pattern with one of the wings moving more easily and further up than the other side? Or is there a side bending pattern with one greater wing moving more easily towards the front of the head. If your client is in chronic pain, there may be a lateral strain, which you will sense as an out-of-sync movement of both the sphenoid and the occiput. There may be a vertical strain, which might be felt as if the sphenoid is moving up and away from the occiput. Even more severe is a lateral flexion, which feels as if the sphenoid and occiput are both moving together up and away. Finally, the most severe strain is the compression head, which may feel stuck. There is no movement or severely limited movement. Once you have listened and felt and assessed the lesion pattern, you can release the hold. Possibly your presence here has awakened your client's inner physician, and this technique has helped correct the lesion pattern. The next technique is Sutherland's grip. Your intention is to energetically decompress the viscerocranium off of the neurocranium. This technique is wonderful for sinus headaches, jaw tension, and any feeling of physical or emotional compression. Again, place a glove on your right hand or finger cots on your index and middle fingers. Place your left hand over the greater wings of sphenoid with your thumb on one wing and your middle finger on the other wing. Ask your client to moisten her lips and open her mouth. Gently slide your fingers along the bottom surfaces of her upper teeth to the back tooth. Your intention is to lift the maxilla up towards the sky away from her frontal bone. So the angle of your grip is important. Make sure you are lifting up and also pulling down towards her mandible at the same time. Imagine her maxilla being freed from the frontal bone. Create space in her sinuses. Many people with chronic sinusitis have maxillas that are jammed up into their vomer, ethmoid, and frontal bones. Visualize creating space and energetically separating her viscerocranium from her neurocranium. Hold and listen to her teeth dance and talk to you. Feel their rhythm and watch them relax and open. When you feel the rhythm shift into a harmonious pattern, gently release her teeth and then let go of her sphenoid.